Hello everyone. The name of my topic is Sweda. As you all know that the Panchakarma is a branch of Ayurveda and one of the oldest health systems in the world with wide acceptance among large segments of the population. Sweda is a process in which the individual is subjected to therapeutic sweating. It is considered an essential prerequisite to Panchakarma in Ayurveda. Sweda is intended to remove excessive vata and kapha dosha and is contraindicated in pitta disorders. Sweda liquefies the doshas, clears the obstructions of the channel of circulation and directs the doshas to select places from where they can be expelled easily. In the Vedic era, the use of natural remedies like sun rays, fire were advocated as remedy in many disorders and mentioned as destroyers of rakshas, that is microbes. Before administration of Shodhana treatment, Sweda is a process to induce sweating artificially in a patient who had already undergone Snehan, maybe or maybe not. The heat is generated directly or indirectly. Sweda depends upon various factors such as physical strength, severity of dosha, season, site, age, etc. There are specific indication and contraindication for Sweda karma, and the optimal science should be strictly followed for the procedure. The word Sweda is derived from Sanskrit word swed, meaning to sweat. Swed means sweat, which is the mala through which pitta is eliminated. The therapies which help in producing perspiration are called Sweda. In Sweda, certain procedures are done to direct the srotas and to make the body sweat. This is done after Sneha therapy. Sweda works in conjunction with Sneha to facilitate the removal of ama and mala from the srotas and dhatus to transport them back to the koshta. It can be done in specific parts or all over the body. Basically, Sweda therapy uses the Agni principle. What are the mode of action of Sweda? Sweda dravya has its main actions like Sthabagna, Gauravagna, Shitagna and Sweda karakatva. The first is Sthabagna. Sweda relieves Sthabana, means stiffness. Vyanavayu, Shleshak kapha, Amarasa, Mamsa, Meda, Vasa are mainly responsible for Stamba. Vayu by Ruksha Guna absorbs Snigdhata and so causes Stamba. Sweda is Snigdha and Ushna, so it relieves Stamba. Ushna Gun of Sweda does Shrota Suddhi and Amapachana and so it relieves stiffness. Second is Gauravagna. Sweda relieves heaviness in the body. It causes excretion of watery content of the body through Sweda. Apya Tattva or Kleda is Guru. Due to elimination of Kleda, lightness is achieved. Sweda stimulates muscles and nerves and so lightness is produced. Shitagna. This is mainly due to Ushna Guna. Fourth, Sweda karaka. Sweda promotes sweating. Sweda is a type of mala. Impurities of the body comes out with the Sweda. When vata is located at the site of amashay, sudation is administered with the help of dry agents, and when kapha is located in the site of pakvashay, sudation is carried out with the help of unctuous agents. Now let us talk briefly about the types of Sweda. The first is Nadi Sweda, second Peti Sweda, Pinda Sweda, Avaga Sweda and Parisheka Sweda. The first type is Nadi Sweda. In Nadi Sweda, steam is given by the medicated decoction which is generated under the pressure in an instrument connected to a tub through which steam comes out and is being used. The second type is petty swede. In this type of swede, the patient is allowed to sleep or sit in a specially designed chamber containing the medicated vapors. The third is Sweda. Here it is done with the help of specially made bundled warm medicinal pudding. The fourth type is Sweda. It is similar to the tub bath in which warm medicated decoctions are used to induce sweating. And the fifth one, which is Sweda. Here, showering of hot decoction is done on afflicted body parts. Here are the properties of Swedan drugs: Ushna, Tikshna, Sara, Snigdha, Ruksha, Sukshma, Drava, Sthira, and Guru. Medicines which are used in Sweden are basically Tila Tela, Mashi Tela, as they are having Snigdha Gun. Shashtishali is also used as it is having Ruksha Guna. Also, Dashamula Kwat, Nirgundi Kwat is also being used. Now let us discuss or talk about who must undergo Sweden therapy. A person who is suffering from constipation, asthma, stiffness in joints or muscles, paralysis, headache, backache, etc. are supposed to be or advised to perform this Sweden therapy. Contraindication of Swedana karma: alcoholic, pregnant, bleeding disorders, dry constitution, diabetes mellitus, burn, inner wound, poisoning, fainting, obesity. Now, what are the benefits of this therapy? Sweden provides strength to the body and makes it capable to undergo calming detox therapy. It also helps in improving the blood circulation. It also helps in removing the accumulated toxins from the body. It also improves the skin texture. It reduces stress and brings about sense of relaxation. It also reduces the stiffness in joints, muscles, etc. Now we'll talk about the importance of the Sweden karma. Proper sedation administered after oilation therapy pacifies the vata, and by this phases, urine and semen will not stagnate in the body. By application of oil and then sedation therapy, the dry stick becomes soft and elastic. Then what will be its effect in a live human being?